Welcome, Mike Rollmeyer and David Duncan with CarePath Benefits. We are lucky to have Bob McCollins, aka Bald Guy Bob, with us from Edison Health Solutions today. Welcome, Bob.
Good to see you guys. Happy Thursday.
We wanted to have you here today to talk about our connection, our recent partnership with Edison, and kind of how we're excited to offer some more robust benefits than we've had, and make the connection. But give you the floor. Tell us a little bit about Edison and why you guys are excited to be partnering with CarePath.
Well, thanks. And let me reiterate, we are very excited. I think that when we got a chance to talk and really get to know each other, one thing that really struck me and struck our team was how we are so very like-minded. We really want to bring independent benefit advisors, strategic solutions for groups of all size, but especially the small to mid-size employer. And you're passionate about that. And we are fiercely proud of our independence as a independent TPA, working with an independent advisor consultant in that independent advisor community. I mean, that in and of itself, causes me to be very excited about what we're looking to do together with you. So let me first and foremost say that. Outside of that, Edison Health Solutions, third-party administrator headquartered in Tulsa, Oklahoma. We serve a national audience. Again, our distribution is through benefit advisors. So where you are, we look to support independent benefit advisors and to give them those solutions. We've been, as Edison Health Solutions, we've been in business about 15 months. Our heritage as a TPA goes back over 20 years to a local TPA there in Tulsa, Oklahoma, serving primarily the Oklahoma, Texas, Arkansas market, but with some few national type of accounts. But the real legacy and value of Edison Health Solutions, which generally everybody knows, goes back to Edison Healthcare, and quite frankly, all the way back to 1992 when our founder, Tom Emmerich of Edison Healthcare, went to work for Sam Walton at Walmart. Sam handpicked Tom to come in and help fix Walmart's healthcare problems. And Tom's legacy and Walmart's legacy for what they're well known for is their destination centers of excellence, which is what Tom built to benefit the Walmart employees. And then when Tom retired and started Edison Healthcare, we got the benefit of that success, and to use that as the foundation and springboard for everything that we're doing to offer to employers and benefit advisors today.
Awesome. Very nice. Well, one of the things, and you mentioned it, that we're most excited about, or at least I'm most excited about, is the centers of excellence and the level of care that it will bring our members if needed. So can you talk a little bit about that? What's that about? Why is it a good thing?
Yeah, it really is the differentiator for us. And specifically when you can take what the largest of employers have for 10,000, 20,000, 30,000 employee lives. And again, excited for this with you all, but to bring this solution for the biggest employers to a two-person employee group that you all work with, up to whatever size, to be able to bring this big company solution to small and mid-sized employers, again, I think is fantastic and obviously has me excited for this. So Edison Healthcare and our legacy, as I mentioned, Tom Emmerich, when he went to work for Walmart, Tom was an actuary by education. He loved the numbers. He loved to dig into the data. He was HR by career. But when he got to Walmart and really started digging into it, what Tom identified back then in the early 90s and mid 90s, which unfortunately still exists today in our healthcare supply chain and our healthcare delivery system, was an epidemic of misdiagnosis, overutilization, and suboptimal care. And Tom's response to address that in what we kind of call our Edison care formula or care equation is number one, first and foremost, the patient always comes first. In all decisions and all things, you have to take care of the patient. Second in that equation is the D, and that is get the diagnosis correct. Again, when Tom looked at the data from Walmart, and as we continue to see today, the epidemic of misdiagnosis. 35% of all cancer diagnoses are either completely misdiagnosed or they have the wrong treatment plan for that type of cancer. So it's not going to work. 60% of all spine surgeries are unnecessary. So getting that diagnosis correct is critically important. And when you do that, the next step is to get them to the highest quality care provider quickly. And that's where the smart care centers, as we call them, the industry knows them as centers of excellence. When Tom started this with Walmart, and we've since expanded to north of 20 different healthcare smart care centers across the country, that's where we have the opportunity to get that patient connected to the best of the best for cancer, for cardiac, for transplants, for complex pediatric, for spine and joint and ortho and those types of things. We can get them connected to the best of the best who are not incented to cut. They're incented to make the right diagnosis. These are multidisciplinary teams. This isn't one person making a decision. This is a whole team making a decision for the best interest of that patient, looking at all of the data. It's their specialty and it's what they know. So getting that diagnosis correct quickly to that care team and have them with that quality to really take a good look and diagnose that patient. And then if they want to have that done at our smart care centers, they can. If they can't travel or there's a reason, then we coordinate to make sure that care is taken care of in the local market. To be able to do that, we're going to P plus D plus Q equals O. We're going to optimize the outcome, again, first and foremost for the patient, for their family, and for the employer. And that model has existed from the very beginning and continues to deliver unbelievable results for the patients and for their families today. And again, to be able to take that from Walmart to the largest employers and bring them through CarePath to your benefit advisors, to your small to mid-sized employers, that's a very dynamic and effective solution.
Bob, real quick, can you list off just from memory some of those hospitals and then what they excel in? What's their expertise?
Sure. So Cleveland Clinic, for example, Cleveland Clinic is one of our cardiac referral centers. Mayo Clinic for cancer, for complex care. Boston Children's for complex pediatric. Most everybody around sports knows this guy named Dr. Andrews and the Andrews Institute in Pensacola. You know, they've done the Tommy John and the shoulder surgeries and the joint surgeries. They're in our clinic. So that's just to name a few, some of those that are involved. But again, it spans cardiac, cancer, gastric bypass, transplant, complex cardiac, and a whole host of spine and joint type of procedures.
We are very excited to be able to offer those to our groups as well. So thank you for the explanation. Another facet that Edison brings to us is the robust, I say network, but structure of direct contracted providers that you guys have accumulated over the years of service as a previous TPA and then now as Edison. But I understand it's 200,000 plus and growing, correct? Tell us a little bit about that and what that offers.
Yeah, you know, that really came out of what we found with the Edison Healthcare Centers of Excellence model. Again, we don't expect people pre-event or post-event to go to Cleveland, Ohio for pre-care and follow-up care. So we work with the local market and the local physicians to coordinate that care there. Well, we thought, gosh, there's an opportunity to create direct contracts to find, again, high quality providers to deliver this pre-care and post-care and have our smart care centers coordinate in that local market. Well, if we're going to do that, why don't we kind of build and wrap our own network around the smart care centers in that local community? So that's how that started. It has since evolved to a point, that's why we call it evolution. It's constantly evolving and growing. It certainly has pockets where we have larger numbers of employers which have access to the smart care centers. We've got some real strong markets built out. But we know that this is a path forward for us as we've expanded our smart care centers, as now we're kind of serving folks like you that have clients in any sorts of number of states and markets. We wanted to grow that. So we have, we're up to over 200,000 plus contracted physicians, facilities, MRI, ancillary services, really built to support the process of the smart care centers and those type of treatments, physical therapy and rehab places. But our intention is to continue to grow that out nationwide. And who knows, maybe someday it'll be large enough where it will be our own network. But really right now, our focus is to support the growth of our partners, of the benefit advisors for those folks that have clients in Lima, Ohio, or in Wichita, Kansas, or Fort Smith, Arkansas, that kind of get overlooked, right? They get overlooked. Everybody knows Chicago and Philadelphia and St. Louis and Atlanta and places like that, but that's not really where, as I like to say, the Tommy boy businesses of the world are. And that's where we want to go to support them. So we're very proud of what we built so far. It's certainly nearly not enough, and we're going to continue to add to that. But that direct contract approach to support the smart care centers and that high quality care in the local market is what we're looking to deliver. And we're real excited about where we are, but not any way in shape or form sitting on our laurels at 200,000. We want that to be a lot more.
Awesome. Well, we are excited to provide that value as well. So thanks for the explanation on those.
Yeah, so from what, if you're listening online, if you're still with us, I think what you can tell here is that CarePath is getting better. We got a lot stronger with this partnership. We're super excited about it, as we've said. We are like-minded people. We are passionate about serving even the smallest of groups. So if you're a broker out there and you need a small group product, please look us up, reach out to us. CarePath Benefits. We're happy to get you a quote here this fourth quarter. So Bob, thanks again for joining us. We appreciate the time, and you'll be seeing more of Bob and us on LinkedIn. We've just looked at the tip of the iceberg today. So super exciting things to come. Thanks again, Bob.
Thanks, Bob.
Thank you, guys. Have a great rest of your day. Thanks, everybody.
All right.